The Climara Patch, Transdermal Weekly is a hormone, estrogen, medication used by women to reduce symptoms of menopause, such as hot flashes and vaginal dryness. These symptoms are caused by the body making less estrogen. It can also be used by women who are unable to produce enough estrogen due to conditions like hypogonadism or primary ovarian failure. Additionally, certain estrogen products may be used by women after menopause to prevent bone loss, osteoporosis. It's important to note that there are other medications that may be safer and also effective in preventing bone loss, so they should be considered before starting estrogen treatment. If you are using this medication to treat symptoms only in and around the vagina, products applied directly inside the vagina should be considered before medications that are taken by mouth, absorbed through the skin, or injected. It is recommended to discuss the best time to take this medication and the proper dosage with your healthcare provider. Before you start using Climara Patch, Transdermal Weekly, make sure you read the patient information leaflet from your pharmacist. If you have any questions, ask your doctor or pharmacist. To apply the patch, peel off the backing and place it on a clean, dry area of the lower stomach or the top of the buttocks. Press firmly for about 10 seconds. Do not apply the patch on the breast or on oily, broken, or irritated skin. Also, avoid areas where it might be easily rubbed off. The patch is usually worn for 1 week and then replaced. Make sure to follow the dosing schedule carefully. The dosage is based on your medical condition and response to treatment. When replacing your patch, apply the new patch to a different area and wait at least 1 week before applying a patch to the same area. Dispose of the old patch away from children and pets. Do not flush the patch down the toilet. If the patch falls off, reapply it to a different area. If it does not stick completely, apply a new patch and wear it for the rest of the 7-day period. Do not wear 2 patches at the same time. Use this medication regularly to get the most benefit from it. Change the patch on the same day each week to help you remember, and it may help to mark your calendar as a reminder. If your condition does not improve or worsens, make sure to tell your doctor. Some common side effects of the Climara Patch may include skin redness or irritation at the application site, abdominal pain, nausea, vomiting, bloating, breast tenderness, headache, or weight changes. If any of these effects persist or worsen, it's important to speak to your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, it's important to seek medical attention if you experience any serious side effects, such as persistent nausea or vomiting, mental or mood changes, breast lumps, unusual vaginal bleeding, severe abdominal pain, yellowing of the skin or eyes, swelling of the hands, ankles, or feet, increased thirst and urination, or symptoms of blood clots. In rare cases, this medication may cause serious allergic reactions. Seek medical help if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you experience any other effects. If you're in the US, you can report side effects to the FDA, and in Canada, you can report them to Health Canada. Estrogens, whether used alone or with another hormone, can have serious side effects. It's important to talk to your doctor about the risks and benefits of hormone treatment and to not use estrogens to prevent heart disease or dementia. Using estrogens can increase the risk of cancer of the uterus. Taking a progestin as directed by your doctor can help decrease this risk, so be sure to tell your doctor if you have any unusual vaginal bleeding. In postmenopausal women, using estrogens, with or without a progestin, can increase the risk of breast/ovarian cancer, stroke, dementia, and serious blood clots. When used with a progestin, estrogens also increase the risk of heart disease. The risk for serious side effects may depend on the dose of estrogen and how long it is used. It's important to use this medication at the lowest effective dose and for the shortest amount of time. Make sure to discuss the use of this medication with your doctor and check with him, her regularly to see if you still need to use it. If you will be using this medication long-term, you should have regular complete physical exams as directed by your doctor. If you have any allergies or medical conditions, it's important to talk to your doctor before using the Climara Patch. This includes a history of certain cancers, blood clots, heart disease, liver or kidney disease, high blood pressure, diabetes, and other health concerns. It's important to avoid smoking while using the Climara patch, as it can increase the risk of certain health issues, especially in women over 35. If you are planning to have surgery or will be confined to a chair or bed for an extended period, be sure to inform your doctor, as special precautions may be needed. Using the Climara patch may cause skin discoloration, so it's important to limit sun exposure and use sunscreen. If you wear contact lenses, you may experience vision problems, so be sure to contact your eye doctor if this occurs. If you are nearsighted or wear contact lenses, you may develop vision problems or trouble wearing your contact lenses. Contact your eye doctor if these problems occur. If you are going to have an MRI test, tell testing personnel that you are using this patch. Some patches may contain metals that can cause serious burns during an MRI. Ask your doctor whether you will need to remove your patch before the test and apply a new patch afterward, and how to do so properly. If you are pregnant, planning to become pregnant, or breastfeeding, it's important to consult with your doctor before using the Climara patch. Additionally, children may be more sensitive to the effects of this medication, so monitoring their growth and development is important. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Climara Patch, Transdermal Weekly include aromatase inhibitors, such as anastrozole, exemestane, letrozole, fezolinetant, fulvestrant, aspemifene, raloxifene, tamoxifen, toremifene, and tranexamic acid. It's also important to note that this medication may interfere with certain lab tests, potentially causing false results. Make sure to inform lab personnel and all your doctors that you are using Climara Patch, Transdermal Weekly. If the Climara patch is chewed or swallowed, it can be harmful. If someone has overdosed, remove the patch if possible. For serious symptoms such as passing out or trouble breathing, call 911. Otherwise, call a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It's important not to share this medication with others. Make sure to have regular complete physical exams, including lab and/or medical tests, while using this medication. Your doctor will provide instructions on examining your breasts, and it's important to report any lumps right away. Don't miss any medical or lab appointments and consult your doctor for more details. Preventing or controlling high blood pressure, high cholesterol, and diabetes can help reduce your risk of heart disease and stroke. Lifestyle changes such as reducing stress, eating a low-fat/salt diet, losing weight if overweight, exercising regularly, and stopping smoking can help. Keep your mind active with mental exercises, like reading and solving crossword puzzles, to help prevent dementia. Talk to your doctor about lifestyle changes that might benefit you. For reducing hot flashes, lifestyle changes like stopping smoking, dressing lightly or in layers, avoiding/limiting certain foods, spicy foods, caffeine, alcohol, reducing stress, and exercising regularly may help. To promote healthy bones, increasing weight-bearing exercise, stopping smoking, limiting alcohol, and eating well-balanced meals with adequate calcium and vitamin D are important. You may also need to take calcium and vitamin D supplements, so consult your doctor for specific advice. If you forget to change your Climara patch at the scheduled time, make sure to replace it as soon as you remember. It's important not to use more than one patch at a time. When storing Climara Patch, Transdermal Weekly, make sure to keep it at room temperature and leave the patch in its pouch until you are ready to use it. It's important to keep all medications out of reach of children and pets. When it comes to disposing of the patch, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to properly discard the product when it is expired or no longer needed, following the instructions in the How to Use section. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.